the Hauptman-Woodward Institute, our motto is, "The cures begin here."
We've always kept at the forefront of research. We've always been developing the methods and the tools that many other places use, and we've been applying those tools and those methods in-house.
They think of a possible solution decades before it can then be converted into a treatment plan.
In HWI, we have a homegrown institute with a national and international reputation for high-quality science.
The idea of discovering something that nobody knows, that nobody else has ever seen, I think that's what drives the passion of the people here.
It's not work for me, it's my passion. It's like what I really enjoy doing.
Small research institutes like Hauptman-Woodward have to do something uniquely well in the world if they want to survive and be visible. Otherwise, they fade away. And Hauptman-Woodward has had a wonderful history in this regard.
It began in 1956 with a doctor, George Kepf, and his patient, Helen Woodward-Revis. One day, they had a discussion.
And she said, "What would you really like to be doing?" And he said, "I'd like to be doing research that will get to the bottom of thyroid disease." And she said, "How much would it cost to set something like that up?" And he told her what he thought it would cost. And she said, "I'll work with you. I'll give that to you. Let's make it happen."
The Medical Foundation of Buffalo that George established with Helen's generosity had great ambitions to advance medical science. Their mission, talent, and successes attracted national and international attention. They also attracted Dr. Herbert Hauptman, who joined the foundation in 1970. Dr. Hauptman, whom we all knew as Herb, was a brilliant and delightful man.
Herb Hauptman was a very special person, a Nobel laureate who was as humble a person as you'd ever find, as approachable a person as you'd ever find. He was all about teaching and reaching out to others, never took credit for himself. And he really epitomized the spirit and the culture of this organization. And it's, I think, true to this day.
Herb used advanced mathematics to create a method to determine the three-dimensional structure of chemical molecules. Those chemicals govern all the processes that are important in our cells. Their structures determine what they do in our bodies, and that knowledge is crucial in almost all medical progress.
A key tool that is actually applied to every pharmaceutical that you can get from the drugstore today. We know what they look like because of what he did. We know how they work because of what he did.
That was such an important breakthrough that Herb was awarded the Nobel Prize in Chemistry in 1985. Herb's methods continued to be advanced and refined, and the Institute became a model of scientific excellence. It attracted talented researchers in disciplines from mathematics to biophysics and beyond, working together in basic science to improve health for all of us.
The cooperation that existed and exists to this day meant that we could do the kind of collaborative research which produced results better than any one of us could have done individually. It was an example of the sum being greater than its parts.
Having a collection of people who view things a little differently, who bring a different take on how something should be accomplished, and then melding the best of the best to accomplish your goal, I think is something that's really unique to Hauptman-Woodward.
Things happen here that wouldn't happen as well anywhere else.
In 1994, the Institute was renamed in honor of Herb Hauptman and Helen Woodward-Revis to recognize the important roles of both dedicated scientists and dedicated philanthropists in advancing basic research. The Institute's capabilities and reputation have attracted other top scientists to Buffalo, including Dr. Candace Johnson of Roswell Park Cancer Institute.
I'm a very translational scientist, and so outstanding basic science is something that I'm very attracted to, and everyone knows about HWI, and it was a very big part of my choosing to come here.
How does basic research at Hauptman-Woodward begin to cure a disease? We study the shape of biological compounds of all kinds, hormones, enzymes, proteins, drugs. Their structures determine their functions.
By understanding the shape of the molecule, we can then understand its function, and by understanding its function, we can design something to actually help that function along to do something good, or inhibit that function to stop it from doing something bad.
Insulin is a good example of a significant Hauptman-Woodward contribution.
There are two major types of insulin. There's fast-acting insulin, which is taken immediately before meals and brings the blood sugar down with the meal. And there's long-acting insulin, which acts over a 24-hour period.
A small change in the structure will determine whether the insulin is fast-acting or long-acting. And thanks to that discovery at Hauptman-Woodward, millions of diabetics are better off, including Dr. Snell.
I take both long-acting insulin and the short-acting insulin. I'm a person that's benefited from the research at the institute I work at, the institute I lead.
We examine the 3D shape of a molecule by analyzing purified crystals of the chemical. We grow these crystals in a special lab, which is one of the unique capabilities of HWI.
Really the only lab, or one of the very few labs in the world, that offers this kind of technology to the general community. We've had over 2,000 scientists send us samples from about a dozen different countries.
We do our work in a state-of-the-art research facility that was built with the generous support of friends. The building was designed by scientists for scientists, with an open flow that encourages collaboration.
We wanted discussions to happen. We wanted one laboratory to talk to another laboratory. We wanted the staff in one laboratory to talk to the staff in the other laboratory. We wanted ideas to germinate, to grow.
And it works.
I'll walk through the building and say, wow, look what we've done. And look at the science and look where it's gone. It's fabulous.
We also have exciting collaborations with many other organizations, especially our neighbors.
The HWI really was part of the core group that started the Buffalo Niagara Medical Campus, the concept, which really is an academic health center, which has the research, which has the clinical part of it, has the hospitals, and now with the medical school moving down, it has the teaching part of it.
Our basic science component was crucial.
Given the reputation and given the facilities that exist here in crystallography, that has been fabulous sort of collaboration, and actually that's why we are able to attract better students, we are able to attract better faculty. That has been phenomenal.
And we intend to make that scientific excitement continue and keep growing.
If you want the cures of today for your children, don't do anything. But if you want new cures, you have to be doing the research that we do today so that you can have those new cures in the future.
It's very important for an organization like HWI to get their message out. It's sometimes very difficult to explain to the layperson about how important this is and what a central part an HWI institution plays in actually the success of a, quote, Roswell Park. We're a cancer center. We do translational things to help patients to try to take basic science observations and translate them into something that may help a patient. But if you don't have that really outstanding basic science, you can't translate anything.
No microscope ever cured a disease. But there are a lot of diseases we would never have cured if we didn't have microscopes.
We're making that investment so that 20 years down the road, 30 years down the road, we can have something that's much better.
We need to support HWI, and we need to be there for them because they're a part of this whole continuum.
What about the next 60 years?
I think there are a lot of people who've known HWI for a long time through the history of HWI, and they've seen several prominent scientists retire. And to assure them that the next crop is here, they're doing it, they're doing great research, and they are inspiring the next generation of scientists to come here and work, and they're also helping to educate them.
Through our history, we've developed successful education programs for high school, undergraduate, and graduate students. We're committed to training future scientific leaders, and perhaps our next Nobel laureate.
In 10 years' time, I would like to see us double the size that we are at now. I'd like to see twice the number of laboratories, twice the researchers working here, and also twice the students.
I think what the Institute can provide is some seed funding that will allow people to develop new ideas, something that maybe is a little bit riskier. It's not quite ready yet for funding from the federal government. But if it's a good idea, then you need something that allows you to sort of move in that area.
We have to look to the next generation of unique and exciting science that makes us visible far beyond our size.
And with persistent curiosity, the cures will continue to begin here.
My hope is that at the end of my career, I'll have the satisfaction of saying that, yes, this therapy that is now in wide use was developed because of the work that we did.
With continued support, the cures of the future will begin here.
I'll work with you. Let's make it happen.